Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Jim Masters. On each edition of our show, we introduce you to some of the most innovative business leaders in the country today. You'll discover what their products, services, technologies, and business models can do for you, what they're doing to change our world and change the way we do business.
Who would have ever thought that a tool initially developed by the U.S. Navy for treating deep-sea divers suffering from decompression illness would turn out to be a highly effective tool for treating patients with wounds that just refuse to heal? Well, it is a fact, and it involves this. It's a hyperbaric chamber for hyperbaric oxygen therapy, and it is making a huge difference in a large portion of the population today. This, by the way, happens to be the premier hyperbaric chamber in the world here at Presbyterian Hospital in Dallas. It is able to recreate the conditions of taking an individual as deep as 165 feet below the ocean or 30,000 feet above the planet. That is higher than Mount Everest. Dr. Jeffrey Stone, the president of the Dallas Medical Practice Wound Care Consultants, is the medical director of the Hyperbaric Medicine unit here at Presbyterian Hospital.
Wound Care Consultants is a group of 4 doctors that specialize in taking care of patients with chronic wound care. Between the 4 of us, we have over 60 years experience, and all we take care of is patients that have non-healing chronic wounds. As the baby boomers get older, we find that there's a larger incidence of diabetes, and unfortunately, a certain percentage of patients with diabetes will develop chronic non-healing wounds, and that's where we can come into play to help some of those patients with those wounds. So when a patient comes in, we take a very holistic look and look at the whole patient to see why they may not be healing. We look at things like diabetes that they may not have been diagnosed with. We look at if they have an open sore, is there exposed bone? Is there a bone infection? How's their circulation? Is this a patient that's had radiation and now has a wound because the radiation has killed not only the cancer cells, but killed some of the healthy cells as well?
Tell me what your problem is. What are you suffering from?
I have a rare syndrome called VADERS, which is an acronym where each one has a component and an abnormality. They've had a horrible time healing up, but after 15 treatments, I feel stronger. Haven't been able to sit and go and do things because of the pain from the sores. I have 3 wounds. One is closed, one is almost closed, and then I have one that's healing on the hip, but it's a big one, but it's getting a whole lot smaller.
Carrie Ann Clinton is as far as the VADERS Association knows, the oldest living survivor with all 5 abnormalities of the VADERS syndrome. And she's been kind of a guinea pig for a lot of things, and she's had over 100 major surgeries and countless minor surgeries since she's been born. She had her first surgery when she was 2 days old, and she had 2 surgeries before she was a week old. Her doctor said yesterday that they'd tried every protocol known as far as treating it short of hyperbaric before they got her into hyperbaric, and nothing worked. They say they like to keep them in hyperbaric until they're really almost totally healed. So she's got 1 big wound yet to heal and 1 small wound. It'll be nice to get her healed and back into her own bedroom and back on the road to recovery again.
When new patients come in, I evaluate them. Do they meet the criteria to be treated with hyperbaric oxygen? We're increasing the pressure. We're having them breathe 100% oxygen, whereas normally you're breathing 20% oxygen. By putting them at 100% oxygen under pressure, we can greatly increase the amount of oxygen that's carried in their blood. Areas of the wound that are not getting sufficient oxygen to heal can be given sufficient oxygen to heal, and that effect lasts for a number of hours after they've come out of the chamber. The Air Force initially got into hyperbarics because of decompression sickness from a pilot flying in a non-pressurized aircraft above 18,000 feet, where bubbles would form and then they would come down and still have bubbles in their system, which the Navy had been treating for years.
He had cancer, head and neck cancer, and he went through 2 bone flap surgeries, and he wasn't healing. So the doctor sent him over here, hoping that the hyperbarics would heal the last one, and it seems to be working. Physically right now, he doesn't have a mandible, which is your jawbone here, and that's why he can't speak. He's got a trach. He's not getting the full treatments like everybody else. They have to wear hoods. He doesn't have to wear a hood. He's in very good condition physically right now compared to when he came in 22 days ago. The difference is his skin's alive on the outside. His blood vessels, the blood flow is working, and the inside of his mouth, they had to replace the floor of his mouth. So the inside of his mouth is healed up compared to before where it was all black and there was no life there. Now there is life.
I had the opportunity to go into hyperbaric medicine, which I had trained for at doing my aerospace medicine residency. So I already had the background, and in doing that, I learned to do wound care, which now I really find it my calling. I like the patients, I like the people I work with, I like being able to make something better.
I'm a double transplant recipient. I got a kidney and a pancreas, but I was diabetic for about 30 years, and so I don't really have any feeling from about right below my knee down. So what happened is I broke my foot, and I was unaware that it was broken because I don't have any feeling. And the bone kept pushing down on the bottom of my foot, which created a sore. And as of right now, it started out, I'd say about 2 inches, and it's down to probably about a ½ an inch. It seems to be working. My doctor's very happy with the process that it's taking, and it's looking much healthier. And quite frankly, before I started coming, it was quite larger. It's actually healing quicker and better.
Our patient population tends to be individuals with multiple medical problems, diabetes or cancer, collagen vascular disease. Patients appropriate for hyperbarics are not normally healthy individuals. They're patients with multiple medical problems. And we have just a wonderful staff here, wonderful physicians, that our whole practice focuses on helping those patients with these difficult wounds. They can read, they can sleep, and depending on the severity of the patient, they could come over here in a wheelchair, they could come over in a stretcher. We can actually be a mini ICU in here, so we have certain critical patients that we can treat.
I was about to lose this leg here. I didn't want to lose it. My wife spoke to my doctor, and they recommended that I come here, and they're going to try to save it. I've already lost 1 leg. I'm going to wind up with no legs. And so I didn't want that. So right now we're in the process of trying to save this one here.
What's it like being in the chamber? You've just come out. What was it like?
It's not very bad. It's just 2 hours, Going to sit for 2 hours and watch a movie and breathe pure oxygen. You're not as light now. You're breathing regular air.
We came here and we was just looking for hope. And that's what this place have given us, hope for the future where we can stay together. And that's what we want to do. We didn't want to separate him to be placed somewhere else where I couldn't take care of him.
And there you are, a close-up look at one of the most unique medical practices in the country today, wound care consultants, whose treatments range from bioengineered skin equivalents and advanced state-of-the-art wound dressings to use of the hyperbaric chamber. I'm Doug Llewellyn reporting from inside the chamber here in Dallas.
That concludes this edition of Close Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.